Hello and Assalamu alaikum, Ultrascan Diagnostics. Today, on the special request of the patient, we're making another video, even though we've clearly identified the area on the lower left, which was previously mentioned. But now that we know the symptoms of the patient in the clinical, so the reason why the patient is suffering from numbness is because here you can very clearly see that the inferior alveolar nerve was in a very intimate contact with the impacted wisdom tooth, and here you can see this radiolucency, which identifies this is where the tooth has been extracted, and this is where the nerve definitely has gotten compressed at the time of extraction. Along with that, like we mentioned previously as well, that there is displacement of tooth structure or bone in the sublingual spaces, which can be seen right here. This radio opacity is definitely a cause of concern, which can lead to lingual swellings and sublingual bleeding as well. And that is something to be kept in mind and needs clinical correlation. The other thing the doctors asked is to see if there's anything other problematic. So we're going to go very superficially through everything. This is an endodontic treatment in the upper left five. Second premolar, a little bit of periapical scarring, but no periapical radiolucencies can be seen. Very voidy root canal has been done. This is the lower left six, which has a obturation material beyond the apex, which you can see right here, but no periapical radiolucencies can be seen. This is the distal root, and now we're going to move to the mesial root, where we can see two canals and no radiolucency. Nothing other than that, very superficially we can see no major cavities can be discerned on this view. This is the axial view. Minor cavities here and there, especially on the distal aspect of the upper left four, can be seen right here. There you go. So the distal part of the upper left four shows a cavity which can be seen right here. And then we move to the lower right six. The lower right six also is root canal treated. No periapical radiolucencies, decent endo. The lower right eight also is very closely associated with the inferior alveolar nerve, but not as significantly as the one on the right hand side. The upper right wisdom tooth has a cavity on the buccal aspect, which you can see right here. If you have any further questions, please feel free to reach to our team. Thank you very much.